I am Head of Counter Fraud at the Trust, and I'm also the lead local counter fraud specialist. So basically I head up the Trust's internal counter fraud service. We are quite a small team, there's only 3 of us. So obviously I head up the team, and then we have Beth, who is the local counter fraud specialist covering our Luton and Bedfordshire services. And then we have Dan Higgs, who predominantly works delivering the counter fraud service for NAFT. Clever statisticians say that about £1.2 billion is lost every year within the NHS due to the vulnerability to fraud. Really, as local counter fraud specialists, we help protect the public purse. Certainly over the last few years, there's been a lot of focus on fraud prevention, but it's obviously much better to be able to prevent fraud than subsequently have to detect it and investigate it. We're not here just to investigate allegations of fraud or bribery. We're also here to support staff in raising concerns, and also here to just help and advise staff. So we get loads and loads of staff contacting us for advice. We're commonly contacted for advice in respect of policies and procedures. So quite often we get questions asked about the standards of business conduct and the rules in relation to declaring secondary employment. Obviously mentioned reference to the public purse. Ultimately, if we're able to prevent fraud, that means that there's more money to be spent on patient care and to benefit them, whether that be more staff, additional member staff on a ward, or better facilities for our service users. There's a huge range of allegations that we receive every year, and some common frauds which are investigated across the NHS. I would say the majority of our referrals relate to staff fraud, and we do sometimes get referrals in relation to patient fraud. So within kind of area of staff fraud, the most prevalent fraud, or one of the most prevalent, is definitely working whilst on sick leave. So where a staff member falsely claims to their manager they're unwell, and then they go and do work elsewhere and obviously don't notify the trust. We've definitely seen an increase in timesheet fraud cases, and also cases where our staff have sadly undertaken private work when they're meant to be working for us. And I believe there's been an increase in certain types of frauds, definitely because of the cost of living, but also with COVID and now a lot of us hybrid working, sadly that does create opportunities for some individuals to commit fraud. We've also seen an increase in cases whereby staff have commenced full-time university courses, failed to notify anyone at the trust, and then they're trying to juggle full-time university courses with full-time employment, and they then subsequently call in sick to go and do a placement or attend a lecture, or fraudulently request special leave. Please report it. The quicker it's reported, the quicker we can begin an investigation, and if the allegations are substantiated, it means that we can take appropriate action to recover money, which means money goes back into the trust, back into patient care to benefit our service users.